How do you help a patient understand that the care you're delivering goes beyond just the chiropractic aspirin, aka just pain relief, is you bring in tests like this. So when you bring this into your practice, this will be the first time ever that you have access to the data that is functional, that's movement-based, that's objective, and that goes against normative data and gives you the comparators against that same patient's previous movement. Hey everybody, I am here with Orri from NeckCare. If you've been listening to my podcast, check out my social feeds, you know NeckCare is, in my opinion, the best objective cervical assessment tool. You have the best combo of hardware and software out there, whether you're looking for neuromuscular control, proprioception, range of motion. They are the leading edge of what's going on in the cervical assessment space. And not only that, they've made some massive upgrades to their software over the past few months. So we are fortunate enough to be speaking with Orri, their CEO, from around the world, and he's going to walk us through what some of those assessments mean, what they look like, and also we'll talk about how that can really make a meaningful impact on the care that you're delivering by having the best data possible. So Orri, thank you so much for coming on and chatting today.
Yeah, thanks a lot for having me, Jeff. Yeah, we have been busy this past year for sure, working with our customers across the US and Canada and gathering some feedback. What can we do better and how can we help our customers being more efficient with their time, generate additional revenue for their clinics and helping their patients, obviously, become better. So that's why we're here, and yeah, I'm excited to walk through some of these improvements that we've made.
I love it. You can share your screen. We'll dive right in and take a look. And a couple of the things that I want to bring up as you start to highlight this for the docs out there. And I know we have the gamut. There are some docs listening who are using some what I'll call really clunky tools and assessments. We also have docs that are on the visual side of things still and haven't really brought really diagnostic technology into their cervical assessments. And often technology can be intimidating when you're bringing it into a practice. And you brought up the screen right here. And as we dive in, one of the things I'd be remiss if I didn't bring up immediately is just how approachable your software package is, meaning it looks good. Everything is clear, which is you rarely find in the healthcare space. And I just want to give kudos to you and your development team and design team for making it look good. But as you talk through this, I'd love for you just to, what's your thought process behind having something that has easy flow and good design and the doctor's opportunity to be able to install that in their practice in an easier fashion? What have you seen?
Yeah, absolutely. I mean, I think we care about how the platform looks. Like everything that we do, we want to be top notch. And we've actually heard that not only from the clinician side, they appreciate it, but also the patients. Like the patients feel like, oh, I'm actually getting the top of the line here. I'm getting something that looks like Apple. Like it's not some 1990s software that is clunky and difficult to understand or read. It just works. That's our motto. It should work every single time, and it should look good. The report should be understandable, and it should be here to help, not to hinder.
No doubt about that. And I think the patient aspect that you brought up, I'll touch on it really briefly. And I think this is really important because often, data is one thing. Data that stimulates a meaningful conversation is a dramatically different thing. And often the complexity of the data is inversely proportional. Now, you guys gather a ton of complex data. However, the presentation is in a way where it can generate a meaningful conversation, to your point, because somebody can look at it, as we'll see in a moment, and begin to understand. And from a physician perspective, you can teach on it easily, which is important. You're not having to cross out 75 things. This is the one important thing. It really presents it in a way that the patient can get the take home message very quickly, which speeds up workflow. And ultimately, that's what we want, is our patients to be able to have a better understanding of their health, how we may be able to impact that, and the things they can do themselves. So without further ado, I'll kind of have you lead the way. We're going to create an assessment, it looks like right here. I'll have you talk through it.
Yeah, absolutely. So this is the hardware device. And for those listening, I'm holding a crown, if you will, that goes on the patient's head. And the only thing, you have to do is, okay, what do you want to evaluate? Let's start with the range of motion. You mentioned the visual assessments that a lot of people are doing today. Eyeballing it. And yeah, most of you are doing it, so all good. You're not alone. But there is a better way and a very objective way as well, from a documentation perspective as well. If you're building insurance or if you want to highlight to your patient, okay, this is actually how you are, there is a possibility to do that in a very, very easy and a simple manner. And that's what I'll do right here. So I will do range of motion, and the only thing I'm doing right now is as a patient sitting with the NeckCare device on my head, and then I go through the different motions. So let's start with extension, flexion. That's that. The same for the other planes, left and right rotation, and then last but not least, lateral flexion. So lateral flexion. I might need to visit a chiropractor, but that's another matter. So how long did that take? Under a minute?
For sure. You're probably under 20 seconds. And one thing I want to bring up really quickly is how real time that was. As you were moving, the numbers are coming up, and those seconds matter so much. So as you're going through that, we're seeing it on the screen, and you were able to move right through that. And now we have the data here.
Yes. So we have the data right here. So for example, right rotation, my max range was 52 degrees. Why is it red? Well, we do have a database of healthy individuals. So we then compare the patient's result to our healthy normative data. And I'm definitely here in the red zone, being somewhat restricted on my right rotation.
Right. Easy to see, easy to understand. Love the layout. Great job.
Thanks a lot. And then, I mean, patients really understand this as well. And usually, wow, I have never, ever had a doctor do that before.
Yep. Yeah, being able to tie it in specifically with the charts and graphs that we see here, often, with some of what I'll call the clunky tools, they could give some of the data, but there's no context for it. So being able to see, as you have visualized right here, a patient, you don't have to be a physician to look at this and be able to see, am I underperforming, so to speak? Am I, somewhat restricted, or am I in the clear zone, or am I hypermobile, as we can see as well? So the presentation of this data is really important, tying back to where we were going earlier, which is getting a clear understanding of what's going on and where do I stand compared to, as you said, a general population of people. And that's so meaningful because, 52 doesn't mean anything to your patient. Is 52 good, bad, indifferent? But when they can see it in a graphical, component, as we see on the screen, now it starts to add the context necessary to be like, oh, I'm doing great. Oh, that's an area, that's a potential challenge. That's an area where we're going to address.
Exactly.
Yep.
Exactly. And then, let's say that you actually, see that individual more than once. You can also document the improvement. So this is, an assessment from October 5, where an individual had 55 degrees. And then, hey, today you're actually up to 67.
That's awesome, especially for docs out there as we're doing our progress exams, our re-evals, being able to highlight objectively that progress. That's super powerful and awesome, because I know as we go through, we often see patients moving and functioning better, but to be able to have an objective tool that showcases that easy one click. Love it.
Absolutely. And then because we do have a three-dimensional sensor, and as you pointed out before, I mean, we are capturing a lot of data, even though it doesn't look like it always. We're actually collecting everything that happens from the patient perspective, and we do have accessory movement. So what happens when you rotate to the right? Well, you might also be compensating. You might be flexing or laterally flexing. So we actually capture all of that movement. So you could see here in left rotation, yeah, I had 67 degrees, which is, healthy. However, I was also laterally flexing to the right, 19 degrees. So when I was moving to the left, I was actually doing this.
You're cheating.
I was cheating. Yes.
This is really great. And I want to bring out a couple things to the docs listening and watching. And this crosses professions, but I'm going to speak chiropractic. This is a chiropractor's dream having this, because we all know the compensatory mechanisms that take place. Mm-hmm. And specifically, all the docs out there, that are sports chiropractors, which is a majority of the profession at this point, those SFMA, DNS docs, if you are doing movement assessments in your practice, having the objective tools to be able to do that with the cervical spine, if you're taking care of the cervical spine, a must. Because as you pointed out, we've all seen it obviously in practice where it's like somebody's cheating as they're going through the test. But this is the first time I've been able to see that be measured objectively. And again, this stimulates those conversations that you want to have with your patients, because it's not only always about pain. It's about, are you biomechanically sound? Are you at more risk or less risk for this to come back? Is it going to take longer or take less time to get to where you want to be? And understanding the fundamentals of how they're moving, absolutely critical. Love it. This is a great piece of the puzzle.
Yeah, and what we can also see here, at 10 degrees of left rotation, I actually started compensating. So I know that some of our chiropractic customers, they've told me, oh my God, I now can see that at 10 degrees, something happens. Meaning that they can then tie that actually back to a specific section of the cervical spine that needs adjusting. And for us to hear that our technology is obviously helping in ways that we couldn't even imagine. But yeah, that's been some of the feedback that we've been getting.
Super, super powerful data. You're 100% right. Depending upon which functional unit, which segment we're looking at, we're going to expect it to fluidly move, it properly one way and improperly another way. So being able to see that break point, so to speak, where is that compensation picking up, gives a lot of clues to really what's going on segmentally.
Absolutely. And then from a patient perspective as well, to be able to show someone, yeah, you were able to move 67 degrees, but you actually got there in a questionable manner. And that's what we need to fix. We want to have you green all the way across.
For sure. Great data.
So yeah, do you have any questions about the, range of motion assessment?
Not particularly. I think this is fantastic. Maybe one question that comes to mind. I see it go red, yellow, green, yellow, red. I'm assuming that's when we go from hypomobility to hypermobility. Is that correct?
Correct.
Great. And as far as the data sets are concerned, talk to me a little bit about some of the statistical data that you guys keep and reference, not necessarily the sources, but when you're building normative databases, what do I need to know?
Yeah, you need to know that we have some exclusion, inclusion criteria. So we actually conduct the studies in a clean environment, if you will. We do not use our customers' data in the normative data because most of the time that's not healthy individuals. So we actually have a control group of healthy individuals, US-based, that we have collected, and that's the normative data that we represent in the platform.
That's fantastic. My biggest takeaway from this is, again, docs listening, watching, if you are using a visual assessment, you can see the difference, night and day between what you're doing currently and what you could be doing. Getting more objective data. And if you're using some of those clunky old tools, great to get that data. But again, totally different story to be able to present and converse with your patient about that data. And Orri, one of the things I love specifically is that compensatory information, because we know patients are coming in and often we're not the first people that they've seen as a chiropractor, meaning they've been dealing with these issues quite often for a significant amount of time. And we also know the body's wonderfully dynamic and it's happy to compensate to help us move in and go. And so being able to actually see those breakpoints on compensation, specifically relative to that the rotation and how that can influence the lateral bend, absolutely, I'm going to say critical from a chiropractic perspective when we look at taking care of and adjusting the cervical spine. Love it.
Awesome. And then one thing to add maybe is you can do as many repetitions as you want from 1 to 5. The AMA guidelines, if you are, for example, building an MBA case, motor vehicle accident or PI, you want to do 3 reps. And again, it's super simple to just do 3 from the get-go and have it documented for you. So that's another feedback we've received, simplifying processes and standardizing documentation across your different doctors if you have a larger clinic. And if you're working with insurance companies or claiming reimbursement, to have the data at your fingertips within a minute is pretty valuable.
Yeah, that's great. If I do 3 reps, do I get the information for all 3? Does it average it or both?
Both.
Awesome. Great answer. Cool. What other studies do we have?
So yeah, let's create a different assessment. So we can go into the joint position error. The joint position error test is actually looking at the proprioception of the cervical spine, the position sense. And oftentimes we explain this test as, does your patient know where their head is at in space? And that's also how you can actually explain it to your patient. And patients with dizziness, with, brain fog, balance issues, any post-concussion symptoms, oftentimes have an impaired proprioception.
Yep.
And here we have a way to assess that. And this test has actually been around for a long time, 20 years, heavily researched, typically conducted with a head-mounted laser that you need to use a piece of paper and a pen to do that. But we have made it so it's automated and digital.
Right.
And the only thing a patient needs to do here, let's envision this as a target on a gun range or a dartboard. And my job, I'm actually closing my eyes now as a patient. So how well can I move my head, extension, and then come back to neutral? Reposition the patient. Unfortunately, pretty okay. It seems like.
Well done.
But for people with, dizziness and those symptoms we talked about, they're oftentimes way, way off here.
Yeah, this is a core. As you go through those ranges, I'm going to speak into this for a moment, because proprioception and our ability to know where we are in space, to me, drives home to the core concepts of chiropractic, meaning understanding this is functional movement in my mind, right? How are we able to, from a brain level, process where we're at in space? And we know, based upon an array of the symptomatology that we see in our practices, and I dive into this week in and week out on our podcast. That's why I love this assessment tool, is how proprioception can be influenced, negatively altered by symptomatology, by whatever the case, injury, etc. And also, conversely, how proprioception can be improved through what we do as chiropractors. So being able to have a baseline understanding of your patient's ability to recognize where they're at in space. And I'm assuming as we go through this, of course, we could do pre and post as well. That is information that unlocks a whole new realm. It's like you're able to have your practice become a cutting edge research facility immediately by getting this and gathering this data from your patients, because I can speak into this saying, I never had this. And I think we all know this. We live this as chiropractors, that, man, our patient's ability to function at the highest level, their ability, proprioceptively, to know where they're in space, is intertwined with that. So being able to have objective data to understand how they are moving and their ability to get back to center, quite literally in this case, absolutely impactful. So what are we looking at on the screen here?
Yeah, so here we're looking at, pre and posts, like you said as well. But here at the top was my ability to actually come back to neutral now. And when you take the eyes out of the equation, we're now, focused on the neck and the cervical spine. How well am I actually able to then position myself and finding that my neutral head posture? The eyes are, again, if you have them open, we are, like you said, master compensators as humans. But when I don't rely on my eyes, like, will I fall? Am I able to find that home again? Which is, again, why it's very important from a chiropractic perspective, if you are adjusting the cervical spine, to know, is it functioning as it should? And here in the bottom, you can document that, wow, and connect that now with it. Well, your symptoms are now actually getting better. Well, we can also see that your position sense, your proprioception, your ability to know where your head is at in space is now also improved.
Yeah. There's so many docs out there that I'm going to say fight the idea of, man, I'm sick and tired of only reporting pain. But when I'm trying to highlight improvement, I kind of default to that. This is like the chiropractic dilemma for 126 years, which is, man, we love to talk function over feel. And this tool, this is it. I mean, when you're able to showcase, again, objectively, here are improvements that are irrespective of what's going on with pain. Now, quite often, of course, we're going to see the symptomatology resolve as they're moving better, of course, but to have actual data points that can take you or bridge you out of having strictly a pain-based conversation, I think this is, I'm going to say, revolutionary, because many of us struggle being mirrored in these pain-based conversations while knowing that we're improving function, but not being able to bridge it from a conversational perspective. So being able to have the data, showcase it, highlight it to people in an easy to follow manner is massively, massively meaningful.
And one thing on that actually is that we have heard from our customers that after implementing NeckCare, they have had more confidence in their treatment and the treatment plans. Yeah. They can actually see, are we making the improvements that I think I'm making? And we've heard that time and time again, that I kind of know it's working, but the patient still says that they're feeling pain. So I might differ or change course or whatever. Now we can actually just go back to the NeckCare system, do another reeval, and say, well, hey, you're actually doing better. And that psychological thing as well for the patient, when they see they're doing better, they also feel better.
That's right. We know pain is the last thing to come and the first thing to go. And sometimes on the other side, even if the patient's maybe moving fast through pain, meaning they're getting out of pain within 1 or 2 visits on the other end of that spectrum, there's always that challenging conversation around, well, you're not where you need to be yet, right? Just because you feel better. And, the saying as it goes is true, pain is the last thing to come and first thing to go. But having the data to be able to support that conversation that's a lot easier of a conversation with a patient, where when you can highlight, hey, here's where you're at, here's where you were, here's where we're at today. We got a little ways to go. When it's appropriate, super, super meaningful. And I think about just not having access to this data in such an easy package, hardware, software that NeckCare provides until today. It's just such a game-changing component to what we do with the cervical spine, because all of this has been in the ether forever. So being able to bring it to black and white and in color, on the paper, and showcase it and highlight it, and not necessarily need to take 17 hours and be a research facility yourself, is really, really cool. So
awesome. And then also we have heard that, if you get prompted for an IME, that, hey, you need to justify the treatment longer, or we know that patients have actually taken the reports with them to those IME docs, and, oh, wow, okay, I can actually see that you are making improvements. I'm going to justify more visits. So that's, from an insurance perspective, obviously, everyone loves objective data, and that's what we're here to do.
Yep. Yeah, I think it's great. Yeah, I think it's absolutely great. So this is a great one. Joint positioner, absolutely love it. Chiropractic, I'm going to say, while it might not have been built exclusively for chiropractors, this test has been around a long time. This is the chiropractor's dream in terms of understanding how a patient's moving in space, and then objectively showing the improvement of that over time. Absolutely love it. Looks like we're going to butterfly test next. So what is the butterfly test? I'll have you take it from the top.
Yeah, so the butterfly test is looking at the sensory motor control and the integration between the eyes, the head, the vestibular system, and the neck. And we oftentimes talk about or explain it as, you have 3 instruments playing in a band, and they are all playing the same song, but are they in sync? So this is, again, if your eyes, your head, and your neck are not in sync, you will feel off. You'll feel funky. You might be experiencing, again, symptoms like dizziness, fatigue, sleep disturbances. There's so many things that can actually be tied to that. And it's because your body is constantly trying to compensate somewhere. And that's what we are looking at here. So opposed to the position sense that we looked at with the proprioception, the joint positioner, where the eyes were closed, now we're actually going to have the eyes open. And my job as a patient here is to follow that blue dot, and I'm controlling the black cross. And I'm controlling that with my head, trying to stay on the dot to the best of my ability.
And I have personally done this. This is so much more challenging than it looks. It seems like it would be exceptionally easy, but the fine motor control that the butterfly test exposes, I'll say for many people, is pretty wild. You're doing a great job, by the way.
Yeah, I have done this quite a lot. And And again, that's also the butterfly test was actually invented as both an assessment, but also as an exercise.
Yeah.
So we are conducting a neuromuscular re-education right now as well.
Yeah, this is one of those examples of the diagnostic is the therapeutic, which is nice.
And we have different paths, and the patient doesn't see the path, as you can see. It's random, which makes it even more difficult.
It looks as though the position and the speed is randomized. That's partially the challenge as well, right?
Exactly. And an added benefit to that, you cannot cheat this test. So this is then the most difficult one.
Right. We just went through the easy, the medium, and this is the hard. And I think everybody watching can see the speed and the randomization has picked up quite a bit between easy, medium, and hard.
And yeah, I mean, you said it. This might look easy, but for an individual that is, has an impaired proprioception or sensory motor control post an injury, or this is very difficult, and we will see it right away as well.
Yeah, you did fantastic. That hard one is very, very difficult. But even on the easy and the medium, I'll speak to this. When I did it, when we were together, I think I have pretty good function. Yeah, as a chiropractor myself, and somebody that receives care and is mindful about my body. And these are really challenging. I think there's a lot of information that can be exposed, and this would be a good test for all the docs out there who bring NeckCare into their practice. Do it yourself and have your team do this and see. That's a great way to see exactly how challenging this is. Orri, I think it's clear you have done this quite a bit, because that is super hard, and you have an exceptional score there.
Yeah, thank you. And actually, if we just want to show you some, again, an example of a pre and post. So here, from September, you can see this looks more like an impaired individual, but to be able to show that just with one photo, hey, this is how your fine motor control was, and this is how it is right now.
Yeah, what's the term that you use? I look at the line on the bottom, the lines across the bottom, and it's almost like there's like a spastic movement component. How do you describe that?
We call it jerk. So it's a jerky movement, and you're not able to smoothly go through this path. And we can also just announce this feature actually, but we can now play it back.
Yep.
So we can see here, you can see how jerky that movement is. Even when the dot is traveling super slow, it's difficult for that individual to actually stay on the dot.
Yeah, playing this back is super powerful.
Compared to then, if you look at the top one, post-treatment.
Yeah. Yeah, the bottom one with the jerky motion is exceptionally powerful. I looked at this, and I'm familiar with the system. I looked at the finished version, and it is night and day between what you see. You can clearly see that the line is not fluid motion on the bottom, clearly. But playing it and seeing that in real time, those dramatic alterations takes it to certainly a whole new level. And when I did this test personally, it was super interesting. I'm going to say, especially on the easy and the medium, I could feel joint restriction, because we don't move like this normally, which is awesome to be able to draw out what I'll call the fundamentals of motion. Like I could literally feel areas as I was slowly going through, working very focused on keeping that cross on the dot. I could feel joint restriction, which it was a really interesting feel. I don't think I've ever felt before, moving through that motion. And what happens is the chart and graph at the end tells the story, right? So I don't think I was as good as the top one. I probably wasn't as bad as the bottom one, but somewhere in between. And you could see just where literally, as that jerk took place, my body, it was like trying to stay fluid with the motion and was unable to do so. So very powerful to be able to have that playback. And I'm going to encourage the docs that have NeckCare, utilize the playback feature, highlighting this when you're having the discussion with your patients, because again, I think it takes it to a whole new level. Anybody can see pre and post. Is the line more fluid? Is the line more jerky? But showcasing how that moves in real time, again, that's the story. So
great. And I think from, we've talked about what NeckCare is. This is the ultimate functional test. And we do have, and chiropractors have used x-rays and imaging for a long time. It only tells half of the story. And this is the other side of the story. How well is the individual's function? And some actually have described the butterfly test as the signature of the neck. How well are you actually able to, to draw these different paths by using your neck?
Yeah, this is a great tool. And, a couple things come to mind I want to highlight for everybody. This is really approach and technique agnostic, meaning, as you spoke about this a moment ago, when you're able to understand the functional movement of what's going on in the cervical spine, that crosses all barriers within our profession. So this is information that, regardless of how you approach your care and treatment, is going to be fundamental to how you apply that technique, regardless of what that technique is. Because for the first time ever, I'm going to say, unless you are already using NeckCare, when you bring this into your practice, this will be the first time ever that you have access to the data that is functional, that's movement-based, that's objective, and that goes against normative data and gives you the comparators against that same patient's previous movement. And that is meaningful. It's powerful. And I think about things conversationally. This is how you have productive conversations with your patients, tying back in. Pain is the last thing to come, first thing to go. Am I improving, doc? Maybe they're slower. Maybe they're faster. How do you help a patient understand that the care you're delivering goes beyond just the chiropractic aspirin, aka just pain relief? Is you bring in tests like this that enable you to highlight what's going on, show it in an easy to follow, easy to understand manner, and then be able to help that patient ultimately reach their real goals, which quite often is not just getting out of pain, but getting back to and or better than they were before, with the life effect of how that pain was impacting them. And that comes down to, as we all know, their ability to move, their ability to know where they are in space, to move without compensation, and ultimately the butterfly test, as we see it, taking all things and putting it together. How are they able to really track what's going on, move freely, and then function at the highest level possible? So well done.
Yeah, awesome. Thanks a lot. And the butterfly test has been, heavily researched as well for the past 2 decades, and a lot of studies conducted on that reliability, validity. That's, our history. Like, we have a long history, even though we haven't been on the commercial market for long. There's a lot that goes into creating a product like this, and it's being used by, yes, we've been talking about the chiropractic profession right now, but it's being actively used by medical doctors, neurologists, pain management, physiatrists, physical therapists, chiropractors across North America.
As I would like to say, it is the real deal.
Yeah, well, we'll like to think so, yeah.
Great. Anything else that you wanted to highlight today?
One thing is that we have also introduced an overall scoring system. So taking all these different data points and different assessments, we compile that into an overall score called the Neck Health Index. So now you have the ability to overall, based on the function of your neck from a range of motion, joint position sense, and sensory motor control, how is your overall neck health? And that's also been very, very powerful, and the feedback that we've gotten from a patient perspective. Hey, am I going in the right direction or the wrong direction? Am I trending upwards or downwards in my neck health? And giving that patient education as well. Hey, overall, we're doing what we should be. We're progressing in the right direction or not.
Yeah, that's a great one. So I'm going to ask a couple of questions on that. So the Neck Health Index compiles the joint position error test, the range of motion test, and the butterfly test cumulatively to create a North Star number, so to speak.
Exactly.
Wonderful. And that Neck Health Index can be calculated every time I go through and run these 3 assessment tools on my evals and my reevals to show progress?
Yeah.
Wonderful. Do you recommend that that's something that the doctors have active conversations with their patients about? Tell me how you see the Neck Health Index fitting in with the individual tests.
Yes, for every time you do a re-eval, it depends if people do, range of motion, butterfly, and the joint positioner, or they just do one of the three. But the neck health index is a great way to explain that overall, well, your range of motion is declining, however, your joint positioner is improving. And that's oftentimes as well as we go through treatment. Yeah, we just mobilized you. So now you have more range of motion, but that means that your, refined motor control, takes a dip. But that's okay because it's just part of the journey. So now we also need to work on that stabilization as well to make sure that your fine motor control is getting up to par as well, while we ensure that you keep that range of motion.
This is fantastic. And I'll tie it back to, we've discussed this many times today, but this helps you, doc, get the conversation from pain to function by helping people understand what can I focus on in terms of objective functional improvement that doesn't tie to just how are you feeling today, because we know that'll ebb and flow. We know quite often pain will subside very quickly once they begin care. And we also know that does not mean that they're moving and functioning correctly. So having a single easy score like the Neck Health Index to highlight that during a patient conversations is a very, very powerful tool and ally to have on your side, especially when it's brought from the objective data from that patient. This is not something that's pulled out of the sky. This is utilized and crafted and created based upon that patient, which is based upon and against normative data. So powerful, powerful tool to have as you're having these clinical conversations with your patients. What are we looking at here?
Yeah, so I just wanted to end it on the, report note. And that's also one of the feedbacks that we've gotten is that, obviously our dashboard and platform it's web-based and it's interactive. You can, play around with it. There's a lot of data here, but everyone loves PDFs. You also have the ability here to export it as a PDF. You can download the PDF report straight from the platform to upload into your EMR. And then you have an overall PDF report with all the findings, the accessory movement as well that we went through, the numerical results. So a detailed PDF report with all the results. And literally you can do all of this in under 10 minutes and get this documentation out of the way.
Yeah, that's awesome. Two things come to mind. You highlighted them. I want to speak into them for a moment here. One is that this is great information. If you are, again, taking care of personal injury, MVAs, work comp, whatever it might be, great information to be able to highlight really what you're doing in your practice. Second component, and that could result in, just having a complete record all the way to helping you get paid. On the other side of the coin is ultimately giving patients. I know a lot of us struggle for, during your evals, during your re-evals, like what do I give my patient to take away with them is a constant struggle, because many of us out there are like, we don't want to give them fluff, but we also, it's like, I don't, it's like what on the other side of the coin, I don't know, if you had to take some imaging, maybe an x-ray, it's like, I don't know, that reporting seems a little overwhelming sometimes. So this and it's non-contextual, right? So this provides actually the context of why they're coming into your practice, which is they have a functional impairment. Chances are if they have pain, they are not moving correctly. If they are asymptomatic, they still might not be moving correctly. So being able to give them something to highlight where they can show this to their colleagues, spouse, partner, shared decision maker, whoever that might be, or just have for their own records. So as they go through their health journey of life, they actually have documentation from your practice on where they were at, so to speak. That is awesome and well done.
Yeah, that's a great point. And yeah, I know that our customers are sharing these reports with their patients. And actually, more than that, they've been seeing an increased number of referrals. So I talked to a customer the other day, and he told me he just implemented NeckCare, and he said to me that he had an older gentleman that came in, and he assessed him with the NeckCare platform, and he was so impressed. It's like, oh my God, I've had neck pain for so long, but no one has ever looked at this way, right? Straight away, 2 new patients walk in the door as a referral from that individual, patient referrals. So it's the word of mouth is powerful. And when people haven't actually experienced this before, and we hear all the time as well, like that our customers are now saying patients' feedback is, I feel like you really care. I feel like you're really going out of your way to figure out what the core or the root cause is. and you're doing all these, advanced assessments that I've never even seen before. So I think that's been again one of the feedbacks that we've seen as well, that helping customers, obviously, increasing their revenue and number of patients, in addition to hopefully supporting them in becoming a better clinician.
Or you and your team are doing important work, and you're doing it very well. So kudos to you and your team, and docs listening and watching. If you have not connected with Orri and his team at NeckCare to learn about how you can bring this into your practice, I'm going to encourage you to do so ASAP. Have the conversation, walk through what the process looks like with Orri and his team. They have made NeckCare something that can be in nearly every chiropractic practice. This is something, as he mentioned, that can not only provide you with more clinical certainty, it can help with referrals, and ultimately, this helps your patients get better. How and why? Because for the first time ever, you have actual transparency regarding objective assessment tools for the cervical spine. So you can check it out at neckcare.com. We'll drop that link down in the show notes and description, regardless of where you're watching this. But again, at neckcare.com. Orri, thank you so much for going through these updates. They're awesome. I can't wait to have the next video where we look at the next set of updates and upgrades, which I'm sure you and your team are already working on. It's absolutely fantastic platform and tool. And I'm excited to continue to hear about the chiropractic feedback around how this is helping them improve the lives of their patients.
Awesome. Thanks a lot, Jeff. Always a pleasure.
Thank you so much for watching this video on the Evidence-Based Chiropractor channel. If you don't want to miss a single thing, please subscribe to our YouTube channel so you can get notifications of every video we put out, and we put out new content each and every week. So be sure to subscribe today.